You have just been told that you have COPD, and right now you are probably terrified. Your mind is racing with questions. Will I be able to breathe? Can I still live a normal life? What happens in the next 5 years? But here is what your doctor probably didn't tell you in the rushed 10-minute appointment. COPD doesn't have to be a death sentence, and the next 5 minutes could completely change how you approach your diagnosis. I am Dr. Suman, a respiratory consultant in the NHS, and I have helped thousands of COPD patients breathe easier and reclaim their lives. Today, I am breaking down the 5 essential facts every newly diagnosed COPD patient must understand. Let me start with the basics, because understanding what's happening in your lungs changes everything. COPD stands for chronic obstructive pulmonary disease. Let's break that down. Chronic means it's long term and doesn't go away. Obstructive means your airways are narrowed, making it harder to breathe out. Pulmonary, it affects your lungs, and disease means it's a medical condition. Think of your airways like garden hoses. In healthy lungs, air flows freely. With COPD, those hoses become narrowed and inflamed, trapping air in your chest like a balloon that won't deflate. COPD is actually an umbrella term for two main conditions: chronic bronchitis and emphysema. Most people with COPD have a mixture of both. Here is a critical part. Around 1.3 million people in the UK have COPD, but an estimated 600,000 people are living with it without even a diagnosis. The fact that you have been diagnosed, that actually is a good news, because early diagnosis means early treatment, and early treatment can dramatically slow the progression of this disease. I had a patient, let's call him Mark. He was diagnosed at 58 years of age with COPD. After years of dismissing his breathlessness as just getting older, once we started him on treatment, within 3 months, he was walking his grandchildren to school again. Something he thought he would never do. Here is what you need to do right now. Accept that you have COPD, but don't let it define you. This diagnosis is information, not a life sentence. The sooner you accept it, the sooner you can start managing it effectively. Now, you might be thinking, but doctor, what actually caused this? And this is where most people get it wrong. Most people think that COPD only happens to heavy smoker. That's mostly correct, but not entirely. Smoking causes around 9 out of 10 cases of COPD. Not everyone with COPD has smoked. COPD develops when your lungs and airways are damaged by breathing something in. Smoking is the biggest culprit, but there are other causes people don't often talk about. One of them is workplace exposure. Around 2 out of 10 cases are linked to dust, fumes, and chemicals at work. Welding fumes, silica dust, cleaning products all can damage your lungs when exposed to over long term. Air pollution, both indoor like wood burning stoves, coal fires, and outdoor pollution can both cause COPD. Your genetics, like some people have a condition called alpha-1 antitrypsin deficiency that makes their lungs more vulnerable. Don't forget the childhood factors: lung infections as a child, passive smoking, and poor lung development while the baby is in the mother's womb. All of this can actually affect your long-term development of the lung and cause COPD in the adult age. Understanding your specific cause matters, because that will eventually depend your treatment. If you are still smoking, quitting is the single most important thing you can do right now. Nothing else comes close. Not medication, not exercise. Quitting smoking is the number one priority. If workplace exposure caused your COPD, you may need to change job or use enough protective equipment. This isn't just about managing your symptoms, it's about stopping further damage. I treated a woman who never smoked a day in her life but developed COPD from 30 years of working in a poorly ventilated factory. Once we identified the cause and she changed her work environment, her decline stopped. Here are the action steps for you. Have an honest conversation with your doctor about your exposure history. Write down your smoking history, jobs you have worked, where you have lived, and family history of any lung disease. This information helps create your personalized treatment plan. Okay, so you know what COPD is and what caused it. But what about those symptoms you were experiencing? Let's talk about what's normal and what's a red flag. COPD symptoms develop gradually, which is why so many people miss them early on. Here are 5 key symptoms. The first one is breathlessness. This often comes on gradually. You might notice it while walking quickly or going uphill. It gets worse over time. The second is persistent cough. A cough that lasts a long time or keeps coming back. Many people dismiss this as a smoker's cough. Third one is phlegm production. Coughing up mucus or sputum regularly, especially in the morning. The fourth one is frequent chest infections. Getting chest cold more often and they last longer than they used to. And the fifth one is wheezing. A whistling sound when you breathe, especially when you are breathing out. Here is what terrifies me as a respiratory physician. By the time most people notice obvious symptoms, they have already lost 50% of their lung function. Your lungs are incredibly resilient. They compensate for damage until they simply can't anymore. That's why little cough you have had for months is actually your lungs screaming out for help. The good news, once you are diagnosed and started on treatment, you can prevent this lung decline and improve your symptoms over time and improve your quality of life significantly. I see this pattern constantly. A patient comes in saying, I have just been a bit more breathless recently. When we dig deeper, they have been avoiding stairs for the last 6 months, stopped playing with their grandkids, and haven't walked to the shops in a year. They have been slowly adjusting their life around their symptoms without realizing it. Do this today. Start a symptom diary. Track when you feel breathless, what were you doing? How many times you cough per day? Color and the amount of any phlegm that you might bring up, and your overall energy levels. Bring this to your next appointment with your doctor. This data is gold and your doctor can adjust your treatment based on this. Now I know what you are thinking. This all sounds scary. Is there even a treatment that works? And this is where I have really good news for you. Let me be straight with you. There is no cure for COPD. The damage to your lungs is permanent. But this is a huge but. There are treatments that can dramatically improve your symptoms, slow down the progression of the disease, and help you live a fulfilling life. Here is your treatment toolkit. The first is inhalers. These are your frontline defense. You will likely have 2 different types. One is a reliever for quick relief of your breathlessness, and the other one is preventer, daily use to keep airways open. The second treatment that is very important is pulmonary rehabilitation. This is a game changer. It's a structured program of exercise and education. Studies show it's one of the most effective treatment for COPD out there. The third one is tablets. There are certain tablets that can help reduce inflammation and prevent flare-up. The fourth one is long-term oxygen therapy. For advanced COPD, oxygen can improve the quality of life and help you stay active and even live longer. The fifth one is lifestyle changes. Stopping smoking, vaccination, staying active, eating well, and avoiding air pollution as much as possible. Now here is the truth. Medication alone won't save you. The patients who do best are the ones who take an active role in their treatment. Think of COPD management like a 3-legged stool. The first leg is medication, the second leg is exercise and pulmonary rehabilitation, and the third leg is lifestyle changes. Remove any leg and the stool falls over. You need all 3. I had a patient who religiously took his inhalers but refused to exercise because he was too breathless. His COPD continued to worsen. Then he joined pulmonary rehab. Within 12 weeks, he could walk twice as far without getting breathless. The exercise actually improved his breathing capacity. That's the power of comprehensive treatment. Here is your action plan for today. Learn proper inhaler technique because most patients use inhalers incorrectly. Ask your doctor about pulmonary rehabilitation in your area. If you smoke, set a quit date within the next few weeks. See the local smoking cessation team for support. Start gentle exercise today. Even 5 minutes of walking counts. Alright, we have covered a lot, but there is one more thing that could save your life, and most doctors don't emphasize it enough. A COPD flare up, what we call an exacerbation, is when your symptoms suddenly get worse over few hours or days. Your breathing becomes more difficult, you cough more, and you bring up more phlegm. These flare-ups are dangerous. They can cause permanent lung damage, lead to hospital admission, and significantly reduce your quality of life and accelerate the progression of COPD. Most flare-ups are triggered by chest infection, which could be viral or bacterial, air pollution, not taking the medication properly, and smoking. Every flare-up damages your lung further. Think of it like a car accident. Each one leaves a permanent damage even after you recover. The goal isn't just to treat a flare-up when they happen. The goal is to prevent them entirely. Patients who avoid flare-ups live longer, breathe better, and maintain their independence far longer than those who have frequent exacerbations. I have two patients, both diagnosed at the same time with similar severity of COPD. Patient A has 3 flare-ups in the past year, requiring hospital admission. His lung function has declined rapidly. Patient B has 0 flare-up. He gets his flu jab every year, takes his inhalers regularly, and calls at the first sign of a chest infection. His lung function has remained stable. Same diagnosis, completely different outcomes. Here is your flare-up prevention checklist. Get vaccinated. Annual flu vaccine and the pneumonia vaccine are essential. Have an action plan. Work with your doctor to create a written action plan what to do when your symptoms get worse. The third one is keep rescue antibiotics at home if possible. I know some doctors, they don't prescribe rescue antibiotics, but if you can get some prescribed, keep hold of them. The next is avoid trigger. Stay away from people who have cold. Avoid air pollution on high pollution days. Take your inhalers regularly, even when you feel fine. Red flags to call your doctor immediately are increased breathlessness that doesn't improve with your reliever inhaler, change in flame color to green or yellow, swollen ankles, confusion or drowsiness, and blue lips or fingernails. Let's recap the COPD basics that every new patient must understand. COPD is a chronic lung condition that narrows your airways, but early diagnosis means you can slow its progression. Number 2, smoking is the main cause, but workplace exposure, air pollution, and genetics also play a role. Know your triggers. The third one, watch for breathlessness, persistent cough, phlegm, frequent infection, and wheezing. Don't dismiss the symptoms. The fourth one is treatment for COPD works. When you combine medication, exercise, and lifestyle changes, you need all 3 of them. The fifth one, preventing flare-ups, is crucial. Get vaccinated, have an action plan, and act fast at the first sign of infection. Look, I know this diagnosis feels overwhelming right now, but here's what I want you to remember. COPD is manageable. With the right treatment and lifestyle changes, you can live a full, active life. You are not alone in this. There are 1.3 million people in the UK living with COPD, and many of them are thriving. If you are watching this and you haven't been diagnosed yet, but recognize the symptoms, please see your doctor. Don't wait. Early diagnosis can add years of quality life. If you have just been diagnosed, book a follow-up appointment with your respiratory team. And before you go, I have created a free COPD exacerbation prevention guide. Please do check out the description box for the link. If you found this video helpful, please like it and share this video with someone who needs to hear this. COPD doesn't have to be faced alone. I am Dr. Suman Paul, and I am here to help you breathe easier. If you'd like a personalized care, you can book a consultation at my private clinic in Liverpool and Manchester. Details are in the description box. Take care of your lungs because they are the only pair you have got. See you in the next video.